This is an update of the COVID-19 pandemic and what to expect in the coming weeks. In this video, I'll explain why the extreme measures that are being taken across the U.S. are necessary by explaining the course and the timeline of the disease.
Dr. Terry Shintani, Director of Preventive Medicine.
Hi, this is Dr. Shintani for your health. For more tips on the COVID-19 virus and how to protect you from it, subscribe to this channel and click on the bell for notifications, and look for my previous video on 10 ways to protect yourself from the coronavirus. This past week, more drastic measures have been taken to curb the COVID-19, such as stay-at-home and work-at-home orders, and the shutdown of many types of businesses. Why such drastic measures? In my last video, I pointed out that this is not the flu. Unlike the flu, where most people are taken care of at home, the COVID-19 virus causes sudden respiratory distress and requires hospitalization and the use of ventilators for many patients. The numbers of these patients who need ventilators become so many that it can overwhelm a country's medical system. This is why such drastic measures are required. So, what can we expect going forward? Last week I posted a video with comparison graphs of the U.S. COVID-19 rates compared to those of Italy. Here's how well the horrific Italian numbers of cases and deaths predicted the numbers for the U.S. going forward. In my last video, I pointed out that at first it looked like the U.S. was doing well compared to Italy. But the reality was that we were just around 2 weeks behind, becoming exactly like Italy in cases and deaths, and that we needed to take emergency action immediately. It turns out that the model has become a scary predictor of what's about to happen in the U.S. The model comparing the U.S. numbers to Italy's numbers, frame shifted by just 10 to 12 days, predicted that we would have 25,000 cases by March 24th. In reality, we reached that number by March 21st, and by March 24th, we have around double that number. Actually, this high number is not really a flaw in the comparison. The big increase is due to the fact that we have much more testing being done than before. So it reflects a greater number of cases being found because more testing is being done. In comparing death rates of the U.S. to the death rates for Italy, the model predicted that we would have 827 deaths by March 23rd. The reality is that the actual tally of U.S. deaths from COVID-19 was 553. It's possible that this lower number is the result of better care in the U.S. or the fact that Italy has a shortage of ventilators and hospital beds, resulting in higher mortality rates. In any case, with the current rate of increase in deaths in the U.S. from COVID-19, we'll unfortunately reach the number of over 800 in just 2 days. So what should we expect going forward? To get a better sense of this, it helps to understand the course of COVID-19. According to the World Health Organization, the incubation period, in other words, the time it takes from infection to first symptoms, is about 5 days, with a range of 1 to 14 days. As for the course of the COVID-19 disease, a clear picture of this disease is described in a study published in The Lancet this year of patients in Wuhan, China, who were hospitalized with the COVID-19 virus. For the average patient who died of COVID-19 disease, the time from first symptoms to death was an average of 18.5 days, with a range of 15 to 22 days. In other words, the average person who dies today caught the virus around 23.5 days ago if you add incubation period to the average course of the disease to death. The shortest time to death from incubation would be 1 incubation day plus 15 days to death, or 16 total days. This means that we should not expect a significant slowdown in death rate from the travel and restrictions on large group gatherings that were announced on March 15th for at least 16 days after that. That would be around March 31st or April 1st at the earliest that we would see some change in the death rates. This also means that the business shutdowns and the stay-at-home restrictions implemented on March 23rd will not have much effect on mortality until at the earliest 16 days later or around April 8th at the very earliest. So for now, don't panic. If the numbers don't change for a while, we should understand that this is a matter of the course of the disease. We should all be good citizens and observe all the restrictions together and be calm and be helpful to those in need. Meanwhile, subscribe to this channel for more tips on how to stay healthy and look for my video on 10 ways to protect yourself from the COVID-19 virus. This is Dr. Shintani for your health.